Welcome to The Explainer. Today, we're diving into a really massive topic: how macro forces shape our health. We all like to think we have total, absolute control over our own well-being, right? But today, we're going to pull back the curtain and uncover the hidden societal forces that actually dictate our health way more than we ever realize. By the end of this, I promise you're going to look at wellness, disease, and frankly, society itself in a completely different light. Let's get right into it.
So, think about your daily routine for a second. We usually just assume that our health is the direct result of what we eat and how much we move, that your diet and your fitness are purely personal choices. But the current public health literature completely challenges this idea using a really brilliant metaphor: upstream versus downstream. Basically, you and your daily behavioral choices, you're sitting all the way downstream. But way up the river, there are these massive structural systems making decisions and distributing risk long before you even have a chance to make a choice.
And this idea completely shifts us away from a traditional, purely medical view of health. Imagine a materialistic model of healthcare, where you pick up a prescription bottle, but instead of pills, the active ingredient on the label is just money. It sounds a little blunt, I know, but it perfectly illustrates how our hands are so often tied by those upstream systems. Things like our social position and our income act as the real baseline medicine. In so many ways, our access to wealth dictates our health outcomes way before a doctor is ever even involved.
Which brings us to a really necessary critique of how we usually do health education. The classic behavioral model basically just gives people strict lists of don'ts. You know the drill: don't smoke, don't eat sugar, don't sit on the couch too much. But the research shows that handing people authoritarian lists of what not to do, it just doesn't work. Why? Because honestly, it's a form of victim blaming. It completely ignores the intense, highly restrictive environments that so many people are forced to navigate every single day of their lives.
Okay, so if individual choices aren't the whole story, what exactly is happening upstream? Well, let's zoom out and look at the big picture. The medical literature has identified 7 massive macro determinants of health. We're talking about huge social, political, macroeconomic, commercial, legal, environmental, and trade forces. These are the engines that shape the exact conditions we live in. These 7 forces are out there distributing vulnerability and resources across entire populations before you or I even wake up in the morning. Let's actually break some of these down. First up, we have the political determinants. And to be clear, this isn't about taking political sides. It's about objectively looking at how systems distribute power and opportunity. Public health is deeply shaped by political choices about who gets what, when, and under what rules. That means overarching structural policies, things like deregulation or weak labor laws that keep people overworked and underpaid, literally function as macro causes of disease. Health inequity is very often a direct consequence of these broad policy arrangements.
Closely tied to that are the macroeconomic determinants. The really crucial realization here is that population health isn't just about how much total wealth a society generates. It's actually about how that wealth is distributed. Broad economic realities, inflation, unemployment, massive debt, they hit our health directly through material hardship. If everyday households aren't protected against big economic shocks, the population's overall health is going to inevitably decline, regardless of how high a country's GDP might be.
Then, we have to look at the commercial determinants. This is where we contrast corporate wealth creation with public health creation. Corporate actors have a massive impact on disease patterns, simply through producing and heavily promoting unhealthy commodities. Think ultra-processed foods or tobacco. These aren't just isolated consumer choices happening in a vacuum. Our daily environments are heavily structured by aggressive marketing, pricing strategies, and corporate lobbying. When market systems prioritize wealth creation over health creation, our surroundings become absolutely saturated with risk.
Next, let's look at how legal and environmental forces combine. The law isn't just some abstract downstream policy. It's the primary way a society decides what risks are acceptable and who actually gets protected from harm. At the same time, our planetary systems dictate our baseline survival. So if legal frameworks fail to protect us from unsafe working conditions or pollution, the environment itself becomes a huge hazard. Things like extreme heat, climate change, and food insecurity are massive macro determinants that are heavily shaped by human production.
Now, the really important point here is that modern disease doesn't just stop at national borders. We have to look at globalization and global governance. Think about the supply chain for the fresh food in your local grocery store. It's completely dictated by global trade frameworks. Transnational labor conditions and global trade rules deeply shape our local, day-to-day health realities. Basically, the way institutions operate far above the nation-state dictates how well individual countries can actually protect their own public health.
But I know what you might be thinking. How do these huge, abstract macro forces actually make you sick? Well, it's a very literal physical journey. First, they structure your material conditions, like your housing and income. Second, that shapes your psychosocial conditions, which can create chronic stress or insecurity. Third, that influences your behavioral environment, like what foods are actually affordable or how much free time you have. And finally, we get to biological embedding. This is where repeated adversity literally alters your immune, cardiovascular, and inflammatory pathways over time. It gets under your skin.
Okay, so with all that heavy upstream stuff in mind, we're going to zoom back into the individual because there's a fascinating plot twist here from Emeritus Professor Wagner Marcinus. If the upstream environment is so incredibly toxic and overpowering, why do a high proportion of people living in really marginalized areas still manage to achieve great health and longevity? And on the flip side, why do some folks in great social positions have poor health? This brings us to the salutogenic model. This model completely flips the script. Instead of endlessly studying the causes of disease, it focuses entirely on researching the causes of health.
Professor Marcinez has this really beautiful definition for this. Resilience is to do well against the odds. Those healthy individuals living in tough lower socioeconomic positions, they are the highly resilient ones. They possess what researchers call effect modifier variables, which is just a fancy way of saying protective traits and habits. Understanding exactly what these amazing individuals are doing to stay healthy in an unfavorable environment is the absolute missing link. If we can unpack that resilience, we can design vastly better strategies for public health.
To really grasp this, let's look at the health capital model. It's a simple equation. Investment minus depreciation equals health capital. Think of it like a bank account. Our health constantly goes through depreciation because of those upstream adversities we just talked about. But through positive effect modifiers like strong family functioning, a healthy psychosocial environment, or good cognitive skills developed early on, we make active deposits or investments. Building up strong health capital can literally buffer you against the harmful effects of those massive upstream decisions.
To make all of this super concrete, let's step back in time and look at a very visceral, historical illustration of structural determinants and social class in action. Think about the sinking of the Titanic. This was a massive, shared macro event. It was an environmental hazard that every single person on that ship faced at the exact same time. But how that hazard actually impacted the individuals on board, well, that was anything but equal.
The survival numbers here are incredibly stark. If you look at mortality rates by social class, it tells a wild story. In first class, about 37% of passengers died. In second class, that jumped to nearly 59%. And down in third class, almost 75% of those passengers died. This is a brilliant, tragic illustration of how social class and the resources attached to it absolutely dictate who survives a shared crisis. The iceberg was the immediate cause of the disaster, sure, but social stratification was the underlying determinant of survival.
We can connect this history right back to the foundational work of researchers like Lincoln Phelan. They argue that social conditions are the fundamental root cause of health inequalities. It's pretty straightforward when you think about it. Higher socioeconomic groups just have better access to the resources needed to avoid risk or minimize the consequences of disease. Or, in the case of the Titanic, the physical placement and resources to actually access the lifeboats. And because those groups are better equipped to benefit from new resources, this inequality just keeps reproducing itself over time.
Which brings us to our final thought for today. The macro forces shaping our modern world are immense, they are incredibly complex, and yet they are often really unfair. But remember the salutogenic model and the immense power of human resilience. You are not entirely powerless in this current. By understanding how these upstream forces work, we can focus our energy on building our personal and community buffers. So I want to leave you with a provocative question to chew on. In the face of all these macro forces, what are you investing in your own health capital today? Thanks so much for joining me on this explainer, and keep learning.